Hello everyone. Today we're going to talk about facelift. Skin loses elasticity and facial tissues lose volume as we age. This causes jowls on the lower face, deep creases, and loose skins on the neck. The loss of young features of the face can be caused by a number of reasons, including skin thinning, loss of facial fat, gravity, LV damage, smoking, genetics, and stress. You don't have to give up your young attractive looks as you become older. During this video, we will tell you in details everything related to facelift, how it is performed, and the expected result after the operation. Our role today is to answer most of our questions regarding facelift. Today we have Dr. Rhee, who is a leading doctor at Grand Plastic Surgery. He is going to discuss with us everything about facelift from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Moving on to facelift, first question would be, which is the most popular facelift here in Korea?
I think it is evenly divided. Relative to before, nowadays, the age of the patients is lower. In the past, facelift patients were in their 50s and 60s. Now, there are those in their 20s and 30s, in order to lift the frontal cheek area sagging. It is very polarized. Those younger people can benefit from simply thread lifts, and those beyond 40s tend to have actual facelifts with incisions.
So it is facelift and normal facelift and thread facelift?
Yes.
Okay. So how long does facelift last?
When done through incision, we see them lasting about 10 to 15 years. That does not mean that there is no progression of sagging, but about 10 years later, the face that had the procedure is less sagging than those who have not. So, they last about 10 to 15 years.
What kind of clients should have a facelift?
For facelifts with incision, it is best to do the procedure prior to the various wrinkles such as marionette lines becoming permanent. Just like the fate lines in one's hands are permanent, facial wrinkles can become permanent if left alone for a long time.
Is there any difference between surgical and non-surgical facelifts?
The biggest difference is the lack of incision. In terms of effects, the incisional facelift is much better. But for those who do not have severe sags or folds and are in their 20s or 30s, a thread lift is fine. However, those who have had prior surgery or have lost significant weight, or those who have pronounced sagging, the best is to go for an incisional facelift.
In what age does a client should consider to have a facelift?
Generally speaking, for incisional facelifts, right about 40, just before or just after the age is very common. However, people in their 50s are most common. But age is not the most important factor, but there are those in their 20s who get it as well. If the facial sag is too much, or there are those with excessive facial tissue, and in such cases the skin sags after laser fat removal. For those people, even if they're young, it is good to have incisional facelifts done.
So today we learned many things about facelift, and the doctor explained in details everything related to this common cosmetic procedure. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and respond to you as soon as possible.